I'm Dr. Erin Smith. I work at Community Health of Northwest Florida, the Jackson Clinic. I am a family medicine physician, so I can see a whole host of ages and genders, but right now I focus on adults, men and women. A lot of men, at least the patients I see, will feel like there's nothing wrong. They don't feel bad, so they don't need to go to the doctor. A lot of the times, it'll be the women in their lives who have pushed them to see the doctor for the first time in 5 or 10 years, and we're grateful for that. We do recommend that every adult go see their primary care provider at least once a year to make sure that your insides match your outsides. You're feeling great, so we're gonna keep you doing great. We prefer you come to the doctor when nothing's wrong. Get a baseline. Let us see what you look like at your happiest and healthiest so that we can catch when something does go wrong. A lot of the times we get used to living with something, so we feel like this is normal, but you get to the doctor's office, you mention it offhand that, oh, I go to the bathroom 6 or 7 times in an hour, and then the doctor says, oh, well, that's not actually something we would expect. That's not a normal finding for us. And then we're able to really look into what that is for you and help you be the best you can be. Any medical condition that runs in your family, you definitely should go to the doctor and get that checked on, especially if it's cancer. If you had a family member diagnosed with cancer at a certain age, you should start getting screened for that same cancer 10 years earlier than that family member. So if your dad had colon cancer and he got diagnosed at 45, you need to get screened with a colonoscopy at 35 to catch it. I think the number one thing is really living the best life you can for yourself. And when you get in here, we can help you with that. A lot of people want to eat right. They want to exercise. They want to be here for a long time, be with their families, be with their loved ones. And they don't exactly know what to do. They're Googling, and Google will tell you everything is cancer. So you need to come in, see your doctor, let us get the baseline tests, get the baseline screening for your age, and figure out what we can do to help you stay in good condition. I understand how it can be scary if you don't spend a lot of time in the doctor's office, if you feel good and you don't want to go to the doctor and have them tell you that something's not good. The important thing to remember is that some illnesses, some issues are silent until they're not. Things like blood pressure, high blood pressure, diabetes, high cholesterol, those things are okay until your body can't adjust to them anymore. And at that point, it can sometimes be too late to prevent long-lasting consequences. So we definitely recommend coming in early, letting us screen. It's never the end of the world if we tell you something is wrong, because we're always going to work our hardest to get it right for you. If you're driving down the street and you hit a curb or you run over something, you start hearing a strange noise, but the car still runs, you don't necessarily want to ignore that noise for the next month and a half, because what could have been a $100 repair the day it happened is now a $5,000 repair a month and a half later when your engine's falling out. You don't want that for your life. You don't want that for your car or for your body. I would say it can be finding time, making it your top priority. Sometimes you got work to do, you've got kids to pick up from school, you've got this to fix at home, you've got your honey-do list if that's a thing in your life, and you think, okay, the doctor's not calling and harassing me to do all these things, I've got bills to pay, so I've got to get to work. And all of those things in your life are important. There's a lot of different people and opportunities vying for your attention. But the important thing to think about is that we are trying to keep you here for all of that. So coming to us, fitting us into your busy life and your busy schedule helps you to stay in tip-top shape to keep doing that busy life and schedule. So we have specialists here where even if your primary care provider finds something that they may need a second opinion on, we don't always have to send you out of our building to get that seen and looked at and helped. So it won't take as much time as you think, I would say.
Is it true that women are just tougher than men because you guys go to the doctor all the time and like we're afraid to even walk through the door?
I wouldn't say tougher, but maybe more informed about ourselves.
I'd say tougher.